Thank you, Dan. I really appreciate it. So we have a series of presentations this morning, and my daughter Sophia will be holding up signs for 3-minute warning and 1-minute warning for our speakers, including for me, so we don't go over, and we can keep on running through our program this morning. I'll be speaking about One Health approaches to pollution problems in Indigenous communities using a community-engaged approach. And this space that we're all discussing today, at the interface of human health, animal health, and environmental health, this One Health space is how we thematically focus the research in my lab looking at pollution problems around the world. We all are well aware of the global change phenomena occurring with climate change, with eutrophication of the biosphere, and many other issues. What a lot of people don't realize is that pollution increases are outpacing all other agents of global change. So the rate of increase of pollution in the environment is faster than the rate of CO2 increase in the atmosphere, is faster than the rate of all of these other issues, and yet it's an understudied phenomenon. So here you can see the number of papers published by topic, and global change or climate change, global warming papers are dominating the global change literature, and very down at the bottom, synthetic chemicals. So that's the space that I work in, which is an understudied area of global change. And I just want to introduce you in this brief talk to the research that I do around the world, mostly with Indigenous communities, using a One Health approach on problems of pollution. And these are typically using what's called community-based participatory research, or CBPR approaches, where we work very tightly with the affected communities to study the problem and come up with solutions. So this includes working with the Siberian Yupik people on St. Lawrence Island in Alaska and the Bering Sea, working with the Kowalungan tribe of Onalaska and the Aleutian Islands. We're working in Yuma County with several different groups focused on migrant Mexican farm workers and also the Cocopah tribe, working in Mayan communities in Guatemala on pollution problems, and working in Ecuador on problems of pollution in mangrove forests, several projects in Israel, and then in Australia, working with the Anadili people of Groote Eylandt. So I'm going to just do 1 or 2 slides on each, and then we'll go to our next speaker. We mapped the distribution of contaminated sites around the Arctic, and the larger the dot, the more contaminated sites there are at that location. These are mostly Cold War military installations that have been mostly abandoned, leaving behind a legacy of pollution. We do not have data for the former Soviet Union, but it's probably even worse there than it is in the rest of the Arctic. So a lot of my work is in the Arctic, including on St. Lawrence Island in the Bering Sea. And we use locally occurring fish as our model organism for our One Health approach. We use the fish to look at human exposure to contaminants and what are the resulting effects on everything from gene expression, protein expression, histopathology, development of disease in these animals. This work has been supported by NIH for many years. We're on our 3rd R1 now for working with these communities on St. Lawrence Island. And this project on St. Lawrence Island started due to the advocacy of this woman, Annie Aloha, who's a member of the community there and was concerned about the legacy of pollution left behind by the military and what this might be doing to her tribe. She requested help from an NGO. They recruited me and other scientists to work with them on this program, and it's been really successful. We've been working now for 14 years to characterize pollution and effects on human health and wildlife health, and now to come up with remediation strategies. Another project that's just getting going, working with the Kowalungan tribe in the Aleutian Islands, is we're about to get an NSF grant on this, fingers crossed, sustainable management of human organic pollutant exposure at formerly used defense sites in the changing Arctic. This is in collaboration with the Kowalungan tribe and with the local community in and around this city of Onalaska, which you can see here. And here we're using fish and shellfish as our animal models, as well as looking at human exposure to these contaminants, very similar to the St. Lawrence Island work, with tremendous levels of pollution from these formerly used defense sites, dating all the way back to World War II in this case. In Yuma County, we're working with Yuma Regional Medical Center and the Regional Center for Border Health, the 2 main hospitals that serve the community and farm worker communities, in projects funded by the Flynn Foundation. And more recently, we started a project with the Cocopah Indian tribe, which is just adjacent to Yuma. We've had 3 projects so far funded by the Flynn Foundation: environmental correlates of patient health outcomes in Yuma, Arizona, which is primarily focused on perchlorate exposure and effects on human and animal health. Our animal model is the cactus mouse, which you can see here. Working on health disparities associated with fungicide exposure among residents of Yuma, Arizona. And our latest project just getting going, neurological effects of pollutant exposures and model rodents collected on Cocopah tribal lands. In Guatemala, we're working in the Lake Atitlan watershed, which is the deepest lake in Central America. There's about 400,000 mostly Mayan people who live in the watershed, where they're still using a lot of pesticides that have been long banned in the United States. So we're characterizing pesticide exposures and effects on the food base of the community there, mostly fish and crabs and snails, and also on people and human health. This summer, we'll be looking at levels of pesticides and toxic metals and metalloids in the breast milk of women in the watershed. And in Ecuador, we're just starting to develop a project working on pollution in the mangrove forests, working with a major university in Guayaquil. Jumping to Israel, we have 3 projects. One is looking at the role of pollution in the decline of bats. Bats are in decline worldwide, and one of the reasons might be levels of pollution. So we're investigating that in Israel, which has a very diverse bat fauna because it's at the interface of Eurasia and Africa, so species coming from all of these locations. We're also working to develop a giant insect called the oriental hornet into a pollution monitoring tool. And if this works, there are similar species found throughout the temperate zone and tropics. And also working on a major industrial chemical spill that went into a nature reserve in Israel. And then finally in Australia, we're working with the Anadili tribe. It's an Aboriginal tribe in Good Island off the north coast of Australia, and they're land and sea rangers in order to look at the effects of manganese, one of the world's largest manganese mines, on both human health and wildlife health. This is a northern quoll here. It's a semi-arboreal carnivorous marsupial that's been one of our main study animals, endangered due to the cane toad invasion of Australia, but they're still abundant on the island. And we're working on the effects of manganese on other threatened and endangered species on the island, also with the goal of promoting the health of children. Manganese is a potent neurotoxicant at high concentrations, and the tribe is concerned about the children's health on the island. So we have a few minutes now for questions. Our talks will be 10 minutes long with 5 minutes of question and discussion. I would love to have a little bit of question discussion now. Yes. Thank you. So the question is, how do we make it work managing projects throughout the world? Every one of these projects is composed of a team that includes an NGO partner of some kind, so a local hospital or community organization, as well as a scientific team. And One Health is itself, as you mentioned, interdisciplinary, as is ecotoxicology, where you have to work with chemists, biologists, social scientists, a lot of different fields. So I visit each of these sites every year in order to help with the projects, but we have community groups on the ground working on them at all times, and then some other scientists involved. So it's really just maintaining these collaborations and having good project managers for each of the projects. I'm not sure if I answered your question well, but it is a lot to manage, and most of my efforts are on the research side, so that's what I do. We also have a fish lab here where we can test the mechanisms of toxicity for chemicals of concern that we're studying in these field sites. So we also do laboratory investigations to follow up on some of these ideas. So I think yes. Yes, I think the question is about the scale of research. And so one of the really nice things about working on problems of pollution is these are solvable problems. And for people who work on climate change often feel really frustrated because the policy lags so far behind. But we're actually able to take these projects from characterizing what is the problem all the way through to coming up with funding and a program for remediation for the community. So that makes me feel good to work on something that's tractable. It does take a while, especially community engaged projects are slower than what many of us in science are used to doing. But I think they're also more effective because when the community is involved, you can take it to that level of remediation and solving the problem. I don't know if I answered your question adequately, but so I think we still have time for, yeah, we have 3 more minutes, so a few more questions, yes. What are some of the major outcomes from the research? So we always want to have these projects lead to a solution, and the oldest of the projects that I presented is working with the Yupik people on St. Lawrence Island. And as a result of characterizing the levels of contamination, which chemicals are elevated, what are the health effects in both fish and in people on the island, we've been able to get what's called a research to action, R01 from NIH, where you take this accumulation of research and come up with an action plan to help the community to solve the problem. So we're testing remediation strategies. This August, we're having a gathering of elders from the 2 communities on the island at the site. They want to reestablish their village there, and we're developing priorities for what needs to happen. We're pressuring the federal government to do a health assessment for the island and help us to be able to restore the community. And we're pressuring Army Corps of Engineers to complete the cleanup at the site. So a lot of different efforts going on in order to solve the problems of pollution. But ultimately, that's where we want to get with all of these projects, is coming up with practical ways to address the pollution problems, both for human health and for wildlife. Kelly? Yeah, thank you, Kelly. So the question is about the fish lab. We're just building a fish lab now. It'll be in the basement of MRB here. And it's meant to be a resource for people interested in testing ideas in One Health, where a fish model serves as an excellent model for human exposure and disease. And it turns out fish are terrific models for human disease. About 80% of human genetic diseases, the genes that cause those diseases, are shared with bony fish, such as the fish we use as stickleback. In addition, fish are transparent in early development, so we can look at pathologies in a live animal under a microscope. They have the same endocrine system that we have, so anything that's endocrine disrupting, we can examine in fish. The biology is very similar to human biology, so it allows us to do mechanistic studies on all kinds of problems, not just in pollution research, but maybe some of you are also interested in using this tool. I'm happy to talk more about it with anyone interested, but it should be up and going this summer and meant to be a resource in One Health on campus.